Green Scene, meet Shelly Ullrich, social media manager of the Utah Patients for Cannabis and Natural Choices. Facing symptoms that weren't being adequately treated by the usual medications, Shelly Ullrich sought relief from chronic sinusitis and severe immobilizing fibromyalgia. Early on, she found herself terrified of being found out if she turned to cannabis after receiving a doctor's recommendation. This is a glimpse into her story.
What conditions led you to first discover cannabis as medicine?
Yes, my journey started in the 90s. I thought I was having some chronic sinusitis. My sinuses were just in pain. I have no other way to describe it than a hot poker going up through the roof of my mouth. I had a double earache, and for years they tried antibiotics to no avail. So finally I had a wonderful doctor that decided to try an old nerve numbing medication, and lo and behold, overnight the pain was reduced to half. So we spent the next couple of years trying to refine that, but unfortunately I'm very sensitive to medications and their side effects. So along the way I was introduced to cannabis, and it helped me tremendously. The problem was I was raising two young kids, and I was terrified at the thought of getting caught. Forward a few years to 2015, that is when I started having flu-like symptoms every day for months. Finally, my doctor, after every test known to man and couldn't find anything wrong, diagnosed me with fibromyalgia. And in those tests, she found that I had degenerative disc and facet disease. And through that, last year I had a 5-level fusion in my neck. I'm fused from C1 or C2, to T1. So it's been a long journey. And ironically, in all of this, I had some intervention that turned the corner for me. I had an aunt that was dying of cancer. She lives here in Utah, but she moved to Washington to be with her son. My father and I traveled out there to visit her, and she was the most giving, caring person. Even in her last days, she was giving to others. She gave us a wonderful day, and at the end of the day, she took me aside and said, "Shelly, I know what you've been dealing with. I want to give you what's left of my cannabis oil so you can try it and see if it helps you." I never knew what kind of relief I could get above and beyond just smoking cannabis.
Sure. So
it changed my world and opened the windows to all the information. And another point of irony is the very first time that I talked publicly about cannabis in our group, it happened to be the day of her funeral. So it was poignant for me and an affirmation that I was on the right track. And here we are years later. Who would have believed that we'd had a working cannabis program in our state and that I would evolve to be the social media manager?
Well, congratulations.
So that is my journey.
What a tremendous journey so far, Shelly. Wow.
Thank you.
Yeah, may I ask a question? What specific effects or maybe general benefits were you or are you seeking in medicinal cannabis products?
Well, especially through our group, we're big on education on all the different products and how they interact with you. And they are also different. A lot of patients like me, we do a layering effect, depending on our day and how bad we're feeling. So we'll start out maybe with some sublingual under the tongue. That's what I do. And that's how I'm even able to get out of bed in the morning.
Which sublingual are you using, Shelly?
I have produced my own infused oil, and it works wonderful. I even have a calculator to figure out exactly how much I'm getting. And I found, for me anyway, sublingually, it helps me a lot more immediate as opposed to taking it internally. So that's what I've been doing in the morning and throughout the day, every couple of hours. On top of that, I use a dry herb vaporizer. I have a Firefly, which I love. And that kind of keeps me going in between the oil. And if it's even worse than that, I will have to resort to concentrate to try and curb that pain.
Is it generally pain management, to discomfort, lack of sleep that you're dealing with? As I, they're sort of co-symptoms of the main cause. Would that be accurate?
Oh, yeah. In fact, they liken fibromyalgia to the princess and the pea because we feel everything and we're up most of the night.
Wow.
So, yeah. And people wonder why we're so tired and we can't make plans that we can keep with people, but it's because we only have so much to give every day. And if we have given too much the day before, we're down. So it's a balancing act. It really is.
Hey, let's move on to something a little bit more constructive. Well, I can't say that this has been unconstructive. I'm happy to know these things because, wow, what a dramatic night and day effect you must be experiencing.
Yeah, it is.
Before and after cannabis.
Yeah, and right now it's just a wonderful feeling to be legal, to have my children that are now adults support me and help in progression of making our laws better through the state and becoming active citizens in all of this. That's what we encourage through the group too, is to have people have an open discussion with their legislators or leaders, sorry, I didn't say that right. And to be able to express their views and not be afraid. Too many people are afraid, and we don't need to be anymore.
How, may I ask, is the best way to get involved with your particular group?
You can go to our group on Facebook and like us or our page. We always let you know when there are events or legislature things going on, and that we have given places where you can contact your legislature, or later, I said it again, and that way you can have that dialogue and let them know. And of course, when it's time to vote people in, that's important too. You need to know where their views lie and if they align to your own. We get a lot of people that complain about the problems, but you've got to be part of the solution too.
Excellent. So what you're proposing is that by becoming part or working with your group, you're becoming part of a greater solution for medicinal cannabis in Utah? Yeah,
I think so. We've seen the progress thus far, and it's only going to get better because too many people are in the program now, and it's going to continue to grow. And we need to have our medicine. They've already made it a need, especially during this time. So that is very important in the progress of everything.
Yeah.
Now we're working on helping patients do what I do and produce their own medicine, because a lot of patients are on very tight money schedules every month, and they can't afford to buy the pre-prepared stuff. It's very expensive. But there is the open in for our law to be able to produce your own medicine. So that's very important. We're going to do a series of videos, in fact, with a wonderful patient called Nicole McGarry. And she was on death's doorstep herself a year and a half ago. And now she's thriving and making her own medicine and becoming caregiver for a lot of other patients so that they can do it as well. And we're going to do a series of videos to teach patients how to do this.
All right. Knowledge is power. Seems.
It really is. That's our adage. Knowledge is power.
Mm-hmm. Yeah, superb. And how about this question, Shelly? You must have a few strains that you often use and recognize for their specific benefits. Could you tell us a little bit about which strains you enjoy and that benefit you most, and in what ways?
Sure. The ones I found in the state that I really like is carrot cake. It's a good daytime one for me. It allows me to get things done.
Mm-hmm.
For nighttime, when pain fits in a little harder, I will use things like the purple popcorn and night terror. That's awesome for sleep. Mm-hmm. Ones that I want them to incorporate in the state because they have helped me even more is Blue Dream and Bling. Those two in particular I've purchased out of state. I would love to have available here.
Would that be in Wendover, I would imagine? Or
actually Colorado.
Colorado. Okay. Okay. Right. Superb. Well, that's good to know. And okay, you mentioned that. And then, where do you find the best cannabis pharmacy experience here in Utah? Just kind of curious.
Wow, that's hard to say because the ones that I have been to have been superb.
Mhm.
Perfect Earth with their drive-through is amazing. I think people are very knowledgeable, and
Right.
I can't even discern different ones because they're all knowledgeable. I think they all do a really good job. Wholesome Co. They've got the curbside, and they're getting ready to do the drive-up window for patients. This is really important
Mm.
because we have autoimmune issues, and we can't be around a lot of people right now. So having those available to patients, it's amazing.
Yeah. And you talk to a lot of patients frequently. I mean, many of the people you associate with are also patients, correct?
Yes, being a part of this program has really opened my window to these people's world and not feel so alone. In fact, being a part of this group has given me a purpose because before that I was just a patient and I felt helpless in my own situation. Now I'm able to actually help and give to others in a way I couldn't before. So it's really been amazing to be a part of this.
How has that affected your relationship with your family and friends?
Oh, tremendous. I I'm open now with everyone. I'm out of the proverbial closet. So my family is behind me, my friends are behind me. Um, I've made new friends that I feel are more like-minded. So it's changed my whole world in that way.
Mm. Seems like with the arrival of medicinal cannabis in Utah, I mean, there's been improvement across the board in your life experience.
I would like to see cost management. I think that right now the cost is out of most patients' range.
Mhm.
I would like to see patient caps removed for doctors. They don't have any caps for any narcotics, so why should we have caps with cannabis?
Mhm.
I would like to see, I'm trying to think.
So your issue really, if I may just clarify on that point, Shelley, is that you're really speaking to the issue of the federal position on cannabis as a Schedule 1 rather than a Schedule 2 more accessible medication. Is that it?
I would definitely like to see it freed federally.
Sure.
I think we all would. I mean, it was put there on false pretenses in the first place, and it's well known.
Mhm.
So now with it well known in the public view, it's ridiculous to keep it where it is.
Right. What was the process of obtaining your medical cannabis card here in Utah like? Where did that happen and how did it go?
Um, it was a little tricky in the beginning. They're still trying to iron out that program, but it's getting better. We're helping patients get through it. I was pretty quick, but wasn't able to purchase because I live far out from Salt Lake, and Dragonfly was the first one to open, which is also a very amazing store. I went to their opening, but I was unable to purchase because I didn't have my card yet. Our president, on the other hand, was patient number one in the
How
whole
about
state.
that?
Mario Enriquez, yeah.
Right, Mario.
So-
We know Mario. Hmm.
Yep, we're very proud of that. He was right in the door, and I was with him. So it was
Fantastic.
amazing. Um, as far as other patients, some are having some issues, and we're trying to help them work through it. Our whole group premise is to educate on all things cannabis and other natural choices. I mean, it doesn't matter if it's about the law, coverage in helping, because we've had patients that have had their medicine removed from law enforcement officers. So we've had to give people the law so that they can take it with them and show that this is illegal.
Mhm.
They are not allowed to do that.
Right.
So
Shelley, may I
we
ask
have-
you for some advice on that, that we
Yes.
could share with other patients? What is your advice to medical cannabis card holders who are obviously transporting? I mean, I know you're not a lawyer, but what have you
Right.
found to be most protective that will make sure that you don't get in trouble with the authorities? What do you do?
I make sure I have my card on me.
Is it printed or do you just have a digital copy?
I printed it. I think it's important to have a physical copy. I know they have a virtual one for your phone, but I think having a physical copy is important. And the same with the laws. You can have them on your phone, but I would have a printed copy of that as well. So if you are pulled over, you can say, look, this is your own use, and this covers me for what I'm doing, and you are not allowed to take my medicine. Right. And you don't have to offer any information. If you're pulled over, the most thing you have to say is if they ask you if you're a patient, you tell them yes. That's it. You don't have to say any more, and they don't have to know anymore.
Have you ever experienced this personally, Shelly?
I have not, luckily, but I have talked to many patients that have. And it's a scary process. They're making some of these patients have to get their medication back by going to court. I mean, these people should not have to be treated like criminals in any way.
How long does that process take? I mean, how many? You've seen several cases, I imagine. How long does the whole process from start to finish take?
Unfortunately, months right now.
Months.
They're backlogged. They make people have to come. Like we've had some people in Vernal, especially, and they've had to go all the way back to Vernal, park outside in the courthouse, and they get called, and they put them on the docket, but they are so far behind that, it's taking months just to get.
So these patients are sort of almost being held hostage by the due process.
Exactly.
Well, that sounds inconvenient at the least. I'm glad I haven't personally had to experience that.
Oh, me neither, thank God.
Wow. Well, I'm glad that everything's working out better now. Here's a question that's on a different tack, Shelly. In the world of medicinal cannabis, who do you admire or perhaps even idolize?
Oh my gosh.
Who are the influencers in that space that you pay attention to?
You know, there was somebody I idolized in the very beginning, and that was Christine Sinquist. I think that she started a movement in the state that went so far, and what a wonderful example. I just, her story was amazing. From there, I met Mario Enriquez at our first meeting.
Right.
And he has been a force to be reckoned. He is at everything for us, and that's why we made him president. I'm trying to think. There's just too many. Doug Rice, the head of the Epilepsy Foundation, he is an amazing person. Nathan Kazarian at Utah Satire, he has been amazing. So, you know, there's just been so many people that have been with me and encouraged me and made me feel like this is something that is important and worth fighting for.
Those are people, I imagine, that who live or reside in Utah?
Yes, they all do.
Right. Any interaction or community with people outside of the state?
Oh, yeah. We have people from all over in our group that we talk with. Some that are considering moving back here because they were medical refugees. And they want to know how our system's working and how it's progressing. And some that have already moved back.
Just love it.
Did you ever feel the need to move away from Utah to obtain medicinal cannabis legally?
Yes, we considered it many times. Just my father
has his career, and we wanted to finish that here in the state. So, you know, we had that on the radar, but then when things changed here, it made it much better. Sorry about my dog. The mailman came to the door.
We all have one of those, I think. I mean, I think dogs are a very Utah sort of thing. Yeah, my mailman, my postman, and my dog have a fabulous relationship. Yeah, it's quite funny. So, have you ever found yourself when you're educating friends and family about cannabis? What do you say to people like that?
I love to go into the history. Can you hear me okay?
Absolutely. I can hear you much better now than I did a moment ago, in fact.
Okay, good. My earphones powered off. As far as what I tell them, I have just been very open since I started all this, and that has been making it easier to ease into those conversations. And, you know, I like to go into the history. We have had so much use of cannabis in the history. It was in the U.S. pharmacopoeia up until the 1900s. Physicians fought to get that to stay, but because of control and power, DuPont wanted plastic, the wood industry wanted pulp. We went so many different directions, and people don't realize that we were on the course to be number one in this. And so I like to go into the history. I like to tell people where this came from, how it was used, and that now we're just finally getting back to that.
Excellent. What are some of the most common questions you get as someone who's very, very knowledgeable?
I have been asked, what is a dryer vaporizer? How am I legally able to use this in the state? And where do I purchase these things? And how do you use them? So I've been offering up YouTube videos and information on how these things work. Smoking's not allowed here, and most people are used to that form of using it. So it's an education, and not everybody's at the same place. We all have to share what we know.
On that note, Shelly Ullrich, those are all the questions we have for you at the moment, and we are so very happy that you had some time and energy to spare for Salt Lake City today.
Thank you.
Absolutely. The green scene is lucky to have you here in Utah, and we'll be sure to follow up.
Thank you very much.
Catch us for the next salt-baked patient profile of Mario Enriquez, president of the Utah Patients for Cannabis and Natural Choices.